Hello, everyone. I'm Katie Johnston from The Globe. I write about work, and I've definitely noticed more attention being paid to employees being treated as whole people rather than just worker bees in the workplace. So obviously mental health and wellness plays a big part in that. So I'm very curious to hear more about what these folks have to say. So if you guys could just introduce yourself one at a time, and then maybe tell us what you do personally to maintain your mental health and well-being.
Sure. Hello. I'm Jodi LaMae. I'm a benefits principal at Boston Scientific. I've been with Boston Scientific for about 9 years. And to my own mental health, I actually do heated yoga classes. And I do a lot of walking my French bulldogs.
Hi, I'm Dr. Berzin. I'm the founder and CEO of Parsley Health, where we help patients with complex chronic conditions, both mental and physical, get better and feel better while reducing total cost of care. And for me, I meditate for 10 minutes every single morning. I eat an anti-inflammatory whole foods diet, and I spend a lot of time in community because people are how we drive better mental health.
Hi everyone, my name is Yusuf Sherwanii. I'm the CEO and co-founder of Pelago. We're the leading digital clinic for substance use management, helping individuals from prevention through to treatment overcome substance misuse, things like nicotine, alcohol, and opioid addiction. My background's on the clinical side of healthcare, so a medical doctor by background, and how I manage my mental health is through cooking. I'm not very good at it, but I have a wonderful advocate in my 2-year-old who has very low standards.
Hi everybody, it's nice to meet you all at this iconic building here. So my name is Navin Vettamvelil. I lead total rewards for this company called SoftServe. It is a premier IT consulting and digital services company, founded in, mostly headquartered in Ukraine. In terms of the way I take care of my mental health is I try and get a swim at least like 4 days a week. I try my best for about 35 to 40 minutes. That is like my way of think of it as underwater meditation. And that keeps me kind of going and energized for the week.
Great, thank you. Good morning. I'm Shawna Oliver. I lead global benefits and wellness on Manulife. You might know us here locally as John Hancock. We tell you the weather in the city, and used to have the really big signature at Fenway, which is now in our building downtown. I do a few things. I'm an avid practitioner of boxing and Muay Thai. I attend weekly therapy, and I actually have a weekly coach that I work with as well.
Great. So to start off, we wanted to talk about what's happened since the pandemic, where employers have really taken mental health a lot more seriously, including trying to reduce the stigma attached to it. I'm wondering what changes you all have seen among your employees in the last few years, and what you've tried to do to create a more supportive culture. Shawna, do you want to start off?
Yeah, so the reality is, as employers, it is imperative that we let our employees know that mental health is just as important as physical health. If you think about it, many of us cover physical health as part of our health benefits, right? You go get your annual physical, it's covered. There's a ton of preventive medicine that's covered, but many of us charge to go see a therapist. So what does that say? It says that there's an inequality of importance. And to us at John Hancock Manulife, that's not okay. So it's really important to signal to your employees, we want you to do this. So doing things like removing the cost for these types of services is great. You have to have support from the top down, down up, in the middle, host regular events, encourage people to talk about their mental health. We had a series last week where we brought people all over the globe to talk about what we called their better moments of when they had life events that really changed them. And people openly talked about everything from death of parents to things how COVID impacted them. And so the minute that everyone starts talking about it, not just your leaders, but your managers, your people that work on the floor, everyone just starts saying, I'm going to raise my hand and say this was my moment, is the minute more and more people start talking about it and the barriers start coming down.
Yusuf, did you want to add something to that?
So, as a vendor that works with hundreds of employers covering over 3 million eligible lives, there are a few things that we've seen have really sort of resulted in success from an employer perspective. The first is a recognition that mental health and substance use disorders are highly stigmatized conditions. So exactly as Shawna said, having a conversation as leadership and recognizing that these aren't things that people choose. No one chooses to have an opioid addiction or have anxiety or depression any more than they choose to have a heart disease or diabetes or an MSK issue. So really helping to understand that these are stigmatized issues, we need to have a conversation about it. But then actions speak louder than words. So the second thing really is making sure that you actually have real solutions available, not just check the box solutions, so underutilized EAP for instance, but real clinically led solutions that are specialized in these treatment options. So specialized SED solution can be very effective. And then the final piece is really just around promoting utilization and making sure that people are aware of it, and there isn't punitive action. So people know that by holding their hand up, by engaging in the treatment options available, it's completely safe, it's completely confidential, their employer isn't going to find out. But more than anything, these are services and resources made available for the benefit of employees. And you'd be surprised at how frequently we talk to members, and that there's real fear about engaging with something like this, about the repercussions on their job and their progression.
Anyone else want to add to that? Jodi, did you want to?
Sure. So we definitely saw an increase in mental health post-COVID and also SUD claims as well. And so what we did is we changed our out-of-pocket, or actually our out-of-network provider network to mirror the in-network, so that reduced the cost for employees to actually get access to a network provider. And then recently, for January of 2024, we added a new mental health vendor, so employees have access within 2 days to see a virtual therapist. They also can manage medication management, and they do have in-person. It's a little bit longer, maybe 5 to 6 days to see an in-person. But the cost is essentially, if it's an in-person, it will run through the medical plan for a co-payment or a co-insurance if they're in the high deductible health plan. So definitely the cost factor is significantly reduced for the employees, so they can have access to mental health providers.
Right, I wanted to talk about cost because it's a big issue for mental health therapies. How do you grapple with offering better care without the costs getting out of control? Navin, did you want to talk about that?
Sure, yeah. So cost is absolutely something that every company needs to worry about. So for us, we offer different digital platforms to our employees, which is a cost-effective way of taking care of a lot of these things. So folks can go in and use a variety of resources available across nutrition, fitness, well-being, meditation, a whole lot of things, and those are unlimited. But when it comes to like a live therapy session with the counselor, either virtual or physical, we do put some limits in there. So typically it's like 3 to 4 sessions a month, or like 10 a quarter. So that's how we kind of control costs, because that's the most expensive part of the therapy side of things. But outside of that, our real focus is about the prevention side than the cure. So our belief is that if you can, sort of nip it at the bud, you sort of, can control things down the line. So we look at 3-4 ways in which we do that. First is identification. And a lot of this can be done without any extra investment, because our existing investment that we made into the HR network or our access to data of employees, that helps us identify a lot of these aspects ahead of time. So being able to look at data around overtime, time that's clocked in, time sheets in and out, your laptop login schedule. So those kind of data will help us identify hotspots. The second is around, and this is really important in terms of training. I can't overstate training. So we have what's called SoftServe University. That is our internal learning and development wing. So this team, they put a lot of focus on training managers and team members on a whole lot of things. And since COVID, there's been a lot of emphasis on things like well-being and cross-cultural sensitivity, identifying stressors, and that sort of stuff. And there's a lot of emphasis that the leaders are told to sort of encourage their teams to do this. There's a lot of tracking. There are dashboards prepared on how people take care of their own well-being in terms of just the way they take these courses. And then Communication is another big thing. So continuously communicating all of these things to people, giving them those timely nudges so that they know what's available, where, quick clicks to get to those resources. Keeping on doing it all the time. And then finally, it's about driving a concerted effort to destigmatizing this whole concept of mental health itself. And for that, it's really about getting our leaders to sort of walk the talk. We get them to be front and center in terms of being able to come out there and talk about their own experiences. We have webinars which we conduct where employees can share their own journey in their own space. And the kind of effort that's gone into it, especially for us with Ukraine being the bulk of our headcount, just culturally, mental health is not something that they are kind of prioritizing. So this sort of campaigns have helped tremendously in getting things better. And we've seen almost like a 10x in adoption of well-being programs in our East European countries in the last 18 months.
Did you want to ask?
I'd add to that when you give the right care, cost comes down. And I think for a lot of people, we are not giving the right care. When I was in my training in New York in medical school and in residency in internal medicine, I noticed that we've created this very unintentional revolving door between primary care and specialty care that is spinning faster and faster while patients get sicker and sicker. We are passing people around. And when 60% of American adults have a chronic condition, a condition that they're going to live with for years, if not decades, that doesn't work. And so I started Parsley Health, a national virtual practice where we treat the root cause of chronic conditions, including behavioral health conditions, to see if we could slow down that revolving door and help people get better. When I dug into the data and you look at the workforce data, about 25% of our workforce has not one, but two or more chronic conditions. And these folks are driving about 70% of rising costs. This is market scan data. This is data from our brokers. This is data from our health plans. This is some of your data if you're large employers in the room. And when you look at the mental health component of that, I always want to ask us to back up for a moment and ask, well, why is everyone so anxious and depressed? Why is this rampant? Why is this impacting everyone? And the answer to that is that it's not all in our heads. Okay, so we sit 11 hours a day. A sedentary lifestyle will drive anxiety, depression, chronic fatigue. We look at screens anywhere from 8 to 15 hours a day, also associated with anxiety, depression, insomnia, chronic fatigue. We eat a high sugar, high refined sugar diet, 150 pounds of sugar a year, most of it added sugar, causes brain inflammation, highly causal for anxiety and depression. We have the burden of chronic conditions, and if you have an autoimmune disease or high blood sugar or a GI condition or a nutrient deficiency or a hormone condition, particularly in women that's been untreated or undiagnosed, these things are driving mental health issues. We are not a set of organs in jars lined up next to each other. Our mind and our body are one. And so what I'm excited about when we think about bending the cost curve in mental health is how do we address mental health holistically? How do we understand how the body and the mind are working together? At Parsley, we're actually able to reduce chronic prescription drug burden, get about 25% of people off of behavioral health meds, because underneath there was a root cause of their anxiety, their depression, their chronic fatigue or mental health condition that no one had looked at or addressed.
Yeah, that's fascinating. Yusuf, did you want to add?
Yeah, I really just wanted to kind of ride on the tailcoats of Robin here and really double down on that notion that when you actually look at the root cause of a lot of chronic condition cost, it comes down to people often with uncontrolled behavioral health conditions. In our specific sort of set of experiences, it's people with uncontrolled substance misuse. And it's very intuitive. If you think about somebody with a substance misuse, 1 in 5 people, right? If it's uncontrolled, you're not managing any of your chronic conditions. You're showing up to the ER more regularly. You're showing up to inpatient care. On average, according to the CDC, it's roughly $15,000 of added healthcare expense above sort of baseline healthcare costs. We see this in the claims data pretty frequently for our customers. you have to look pretty deep because often they don't have the diagnosis code associated with SUD, so there are ways of looking at it. But that's all to say that the way I think about cost is having the right combination of benefits and treatment options that are specialized is something you can't afford not to do. That was a double negative, so apologies. But it's really around ensuring that when you get people into controlled care, when you get somebody looking after their substance misuse, for instance, what we find is on average, each individual is generating $9,400 of lower healthcare costs. So the total healthcare cost comes down. There's a very real ROI in doing it. So I think often, rather than thinking about these types of programs as cost additive, it's really around looking at what is the potential ROI of doing this, and then holding vendors to account. So something we're very proud of is having full fees at risk, 100% fees at risk. I think that's something that should be an expectation for all vendors, because ultimately, if you have the data to back it up, you want to align the incentives appropriately.
Katie, if I could just round this out, I think a lot of times when we talk about the fact that we cover mental health care at 100% in very different modalities, we get a lot of people that look at me like that must be a huge cost for you. When we did the analysis actuarially of what that would cost in the first year or two, it was less than 1%. Okay, so think about your budget, think about things that are going on, less than 1%. To send a message that this is how important healthcare is for you. Have we seen utilization go up? Yes, absolutely. It's a great thing. We want people using these benefits. But what have I seen? My short-term disability duration has dropped by over 10 days. My incidence rate has dropped by multiple percentage points. So there's a huge correlation in there. Your benefits are not a silo. It's our job as leaders to look at this and say, it's our entire package and everything is intertwined. So we have to look at it and convince our leaders. It's our job to tell our leaders this all works together, as our employees are our biggest assets in our company. And if we can invest a little here to help the broader picture and get them at their desks doing what they do best, that's a win for us.
Well, and Yusuf, you mentioned substance abuse, which is something we wanted to talk about because it's become a huge issue. How can employers, either you want to expand on that or if others want to talk, encourage workers to seek the help that they need, as well as offer individualized care for it?
Yeah, that's a great question. And I think one thing that we do see fairly frequently is this isn't the type of condition or sort of topic that employees really feel comfortable holding up their hands. Now that's changing, right? Because people are recognizing it's a chronic condition. It's not a moral failing. Nevertheless, often we'll talk to employers and they'll say, it kind of feels like potentially an issue, but I'm not having people request a substance use disorder service, and then you sort of figure out why, and it's like, well, actually we fire people if they fail a drug test. So I think really like overcoming the stigma, trying to understand, the condition, and then sort of not necessarily normalize it, but make sure that people who inevitably, there will be people in the organization who have these types of issues. They know that it's completely safe, anonymous, and confidential to access care. Sometimes, employees, more often than not, they'll feel much more comfortable going to an independent third party that isn't necessarily HR to talk about this. So procuring the right set of benefits is pretty important over here. And then, some of the other things that we found work is just the basic stuff. It's manager training. It's how do you notice, something might be happening. What does a mandatory referral process actually look like if somebody fails a drug screen? Because sometimes drug screens are absolutely necessary. If you have a safety conscious environment, you have to have them, but there are two ways to go about it. You could either punish people and say, well, you've lost your job because you failed the drug screen, or you could say that, we recognize this is a challenge you're going through. In many ways we failed because, maybe we weren't, we didn't promote the services enough, but here is a program that's available if you engage with this, and if they sign off, then you're able to return to work and you can actually have fantastic outcomes. So it's really just changing the culture in order to make sure that people feel comfortable speaking up. And then what we find is exactly the types of metrics that Shawna mentioned. It's increased productivity, it's higher retention in job, it's lower healthcare costs. So there really are dividends to be gained from that.
Do you want to?
Yeah, I'd add to that, as a provider, I can tell you that a lot of people don't know what they have. And we're often waiting, I think, for employee benefits and just at large for the population for people to raise their hand and figure it out. And that's not a viable starting place for a lot of people. A lot of people have what I call FLC, feel like crap syndrome. And they don't know what that is. And for many folks, especially women who are often dismissed and experience bias in the healthcare system, there's quite a bit of data around that. They go to doctors, they don't have time to go to the doctor, so they delay care. They go and they feel dismissed or unheard, or like they're just being handed another pill. And no one is actually digging under the surface and doing what I call the investigative journalism of medicine, figuring out, well, what is going on? And so at Parsley, we've developed a proprietary symptom severity tool. It's published multiple times. It's validated against PROMS 10 from the NIH, and a score of over 50 on this really simple 2-minute questionnaire that you could offer to your entire population for free will indicate that that person probably has an underlying chronic disease because they have symptoms that are of a certain severity in at least 2 body domains. So this symptom severity tool looks at mental health, heart health, musculoskeletal health, GI health, hormone health, because again, we are all connected. The body is an ecosystem. And so when we assess this, it lets us direct the right patients and the right team members into the Parsley program, where we begin with a health risk assessment and a root cause medicine analysis. So we do lab tests that other doctors miss, targeted lab tests. This is a doctor-led program that identifies some of today's most common chronic conditions and risk factors that are often just not tested for. We spend an hour with each patient in the first visit to get to know them as a human being, mind, body, and spirit. And they leave that visit with a health plan that spans nutrition, sleep, movement, mental health, and mindfulness-based stress reduction, and also prescription drugs, referrals to specialists, because you can't separate those things, and we shouldn't be separating them in a medical environment. And so we bring all of that together, and what's the aha moment for so many of the tens of thousands of patients and people who are using Parsley Health is, I didn't know what I had. There are tens of millions of people right now who have a chronic disease and don't know it. And a biometric screening does not give you that data. It is too basic for 2024. And so when we look at patients holistically, we do that root cause assessment, we invest that little bit up front, we can now direct. At Parsley, we manage these folks with complex chronic conditions. If we recognize that somebody has a substance use disorder, we can send them over to Pelago or to your EAP or to the other types of benefits that you have. And we can start to really uncover that. But I think the big miss is that we assume that the people who are walking and talking and ambulatory in this room right now, statistically, the majority of everyone sitting here has at least one chronic condition, if not 2. But we assume that folks are healthy, and then we wait for them to raise their hand when they're sick. And when that happens, especially with today's most common chronic conditions, heart health, blood sugar, autoimmune, GI, mental health, that's usually in a moment when the wheels have fallen off the wagon. And so we're big advocates of getting upstream if we want to engage folks in some of these types of services.
Yeah, that's fascinating. Does anyone else want to add anything on the substance use and how you identify it or help people with that?
I was just going to mention that a lot of times it's the dependence of the employee that might have a substance use issue, whether it's a child or a spouse or partner. And I do think that having, a really good partner in mental health, like a vendor that can manage great either outpatient or if it has to do with like going into in-treatment facility and making sure that they can get into those facilities quickly and manage the whole piece, because then the employee can be more productive at work, which eventually, which does impact return on investment. And so if an employee can leverage resources that the employer is, offering them for their family members, then overall it's going to be a great experience for them and for their dependent.
Right, and family benefits are something that's grown in importance too. Are you all seeing more kind of family mental health benefits being offered, and how do employers get the word out about them? Jodi, I think you had mentioned something about sending out postcards. What's your approach?
So we have really a whole communication strategy. So not only do we send it out to employees via email, we also make sure that we have a direct labor population that are actually on the floor making picking up products. So we make sure that we have information about our mental health benefits in their break rooms. We did do a postcard mailing so that when we introduced our new mental health vendor, that actually went home to people's homes so their spouses and partners could actually see the benefit as well. And then we also work with our ERGs, our employee resource groups, to make sure that they're promoting that benefit, doing tons of webinars and making sure that employees are taking advantage of the programs, because you can you can spend a lot of money and have great programs for employees and resources, but if they don't know about them and if their dependents don't know about them, then you're not really going to see the return on investment. And you just want to make sure that if you're spending that kind of money, that employees are using the program. So
Sure, yeah. Any other thoughts on how you get the word out to family members?
Yeah, so anyone here planning for Mental Health Month in May? Right, so most of us are planning. If you're not, you should be. We do globally an event for Mental Health Month. We have activities almost daily during that month. But one of the things that we do in multiple countries is we do an Ask Me Anything session. We put optional invites on people's calendars. We don't tell them to, we say come. It's actually usually hosted by me and members of my team, and we start it with a story. I usually will tell, I'm pretty open about some of my own personal health moments where I had to raise my hand and say, I need help. And then talk about some of the different vendor partners we offer. We offer a lot of intentionally curated networks. We offer, specifically in the family space, a network for children specifically, and whether it's kids' mental health or specializes in neurodivergent families, and support for parents in that. So we talk about it. We open it up for questions. So there's a live kind of Reddit style Ask Me Anything at the end. And then we follow that up with actually bringing the vendors on site and allowing people to come in. And I know that's a little bit an old school approach, but we get almost 25-30% of our on-site populations coming in and talking to these vendors. And you can sit and say, well, is it really an effective event if they come and pick up a stress ball with a logo on it? Is that really good use? But if they see that stress ball and at a moment in time, 6 months later, it resonates with them and they call it in or they bring it home, it's absolutely a good time. So there's a lot of different ways that you can communicate. People want to learn. They're ignoring their communications now. They want to learn. You just got to jab at them a little bit differently.
And never underestimate the power of the stress ball.
Yes, yeah.
All right, anyone else want to talk about the family issues?
Yeah, I mean, if I might add, so first of all, this is a family challenge. It's not just the employee challenge. I think couldn't be more true. I'm almost embarrassed to say that about 12, 18 months ago, expanding to adolescents and younger people below the age of 18 hadn't been on our radar, and then all of a sudden all of our customers were asking, what is your plan over here? And we really scrambled to sort of meet that. And now it's been about 6 months since we launched our adolescent substance use program, and without exception, every single client has opted into it. And that just really goes to show that there is care about solving this problem, because when it comes to mental health and substance use disorder providers that are just available for a younger population, there's real challenges there. I also think that in terms of promoting these types of programs, these absolutely aren't the types of benefits, to the point that Robin made, that people can necessarily just put up their hand and sort of know when to reach out. So really promoting it using the traditional channels, I would say, is very effective. You should expect your vendors. We absolutely go to on-site events for all of our customers. We do the standard sort of mailers, emails, etc. But a new thing that we've started to do over the last 12 months, I would say, that's been very effective and something worth looking into, is actually using claims data for targeting purposes. Now, this doesn't need to be big brothery and too freaky in many ways, but it's really around ensuring that there isn't fatigue in your population of people receiving sort of ongoing messages from vendors, and really looking at how can you maybe sort of segment out a group of people where that the claims are the highest, because maybe there are dependents or employees that have sort of higher cost conditions, and instead focusing on them from a messaging perspective, or sending a separate sort of campaign out to them. So that's been very effective. We've seen the enrollment rates on the back of that, and the satisfaction and feedback from employers being very positive. It's not something that everyone's opted into, but it can be effective if you do.
So many companies today have global workforces, and they have to deal with cultural differences. Navin, your company has employees in Ukraine.
Yeah.
What have you put in place to help them? And where were there any lessons you learned about helping people cope with crises?
Yeah, absolutely. That's a great question. So 80% of our headcount is in Ukraine, and as you can imagine, when the Russia-Ukraine war started, it was sort of a moment that we had to face up to, and really the company sort of was able to leverage its entire might to sort of raise up to the occasion. So some of the things that were done at the time was there was a global cross-functional team that was set up, like an emergency response team, whose job was to make sure that all the key things that are needed to keep our employees safe and secure were in place. So that really meant being able to do simple stuff like having people be able to check in and let us know that they are safe every day. Because keep in mind, there was no power, there was no internet, and there are all sorts of challenges that were in place at the time. And even our tech teams would use mobile phone locations, geotagging and all that to kind of check on people. The other thing was around making sure the supplies are available to people, right? So many of our office spaces in Ukraine was converted to temporary shelters, so people could come in there, pick up stuff that they needed. They could even stay there if they were not able to stay in their own homes. We had quickly done stuff like making financial aid available to people. So there was up to a limit. People could just send a text message, and we would credit a certain amount to their accounts, or even from the office they could come in and take cash. There were leaves. I mean, people were not told to even apply for leave. You really need to take time off, just go take time off, no questions asked, that sort of thing. So the intent really at the time was to just do what felt right and not try to be perfect, because there was no time to be perfect. You couldn't, things were being done on a war footing, so it was just not possible to check all the boxes. In terms of the learnings, I think, so one is, I think I've never worked with the Ukrainians before, so for me personally, I just find them incredibly resilient and a hopeful group of people to work with. So there's a lot of learnings that I take personally from working with them. The second thing is that I think the very fact that the way we managed this whole thing at the time without sort of focusing on process and having people fill out any kind of forms and stuff like that, it showed a lot of trust that the company put in people. And I think that is paying a lot of dividends now. So if you look at some of our engagement scores, like our surveys that we keep doing every quarter, where people score, give a score on a sense of belonging, or do I feel like my well-being is a priority for the company? I mean, we've consistently in the last several quarters been in the top 5% in the tech industry. So that's something that we sort of feel has really worked well for us. Another thing I feel is that when we look at different regions that the company has offices in, the realities and sort of like the perception of well-being is very different in different parts of the world. So places which are very stable, career aspirations and stuff like those are more important, work-life balance, that kind of stuff is important. But in the Ukraine, it's very, very different, So I think it's, the more we understand and appreciate these cultural differences, and sort of, try to reflect on what we have and sort of try practicing gratitude, I think that in itself will go a long way in sort of, helping us on our own well-being journey. And finally, I just want to say that crisis can happen anytime, anywhere. So, do whatever you need to do to be prepared, because, when the moment comes, you'll often realize that there isn't a playbook for this. And then, you need to have at least 50% of scenarios thought through, and the rest of the 50%, crisis has a way to bring people together, and you got to just trust humanity at that point, and things just tend to work out. This is what we've learned.
That's great. Any other thoughts on dealing with cultural differences and mental health needs?
We have, a good amount of expats that are on assignment and international, and all over the world. And so our, global medical provider, they offer a lot of telehealth medicine for mental health as well. And so just making sure that the expats know their benefits, because a lot of times they feel, they're in a different country, and so we make sure that they have all the materials that they need. They know how to contact their mental health provider and have access to it. And they also have access to our EAP as well, since we have global EAP. So just making sure that, and also they have families that attend their assignments with them, so making sure that their families know about the mental health benefits through our international medical plan.
Right. Very important.
I might just add that as only non-American on the panel, coming from the UK, I wouldn't underestimate the cultural differences. I mean, we still have offices in the UK, and the British stiff upper lip, and these aren't things you talk about, can be a real barrier to people accessing care. I sort of came to the US many years ago and was just shocked by how many people wanted to talk about their feelings. There are cultural differences.
That crosses all cultural lines, I think.
And I would add, it's not just international, right? I mean, I live in New York City. I know Boston is similar. These are incredibly culturally diverse places within a few square miles. And we are a 50-state virtual clinic, and we serve patient populations at companies that have highly tech and white-collar workforces. We also have folks who are delivering healthcare services, food delivery, trucking services across the country. It's a highly diverse kind of group of employers that we work with at Parsley. And it's not just language. I think translation services are one way that we address culturally diverse needs, but I think another way to think about it is personalizing care. And I think we really need to get away from this idea that one size fits all in medicine. Health coaching is a big component of what we do at Parsley, right? Dr. Berzin, can give you a fancy plan. If you go home and you don't do it, because you don't want to, because you don't know how to make a healthy meal or how to take this medication or how to sort of engage with your health, well, you don't get better, we don't get outcomes, right? So nobody wins. Health coaching is a big component of the Parsley program. And yet we also know that one size does not fit all within health coaching. Some of our patients love to talk to their health coach, a lot. A lot of our patients won't talk one-on-one to a health coach if you drag them by their fingernails. Right? Different people want to engage in content and support in different ways. And so we've really personalized that across Parsley to include one-on-one coaching that's of different visit lengths. We have something called the Parsley Wellness Academy, which is over 500 articles, videos, guides, recipes, shopping lists. Some people really just want the content, nudges, reminders. They want to stay engaged, right? And so as you're evaluating services, looking for things that have thought about people as people rather than people as numbers, I think is really important to offering culturally competent care.
Great. And there's also a lot of attention that being paid to diversity, equity, and inclusion in this day and age. Can you guys talk about how employers can make sure that employees are getting the culturally competent care, no matter where they live, especially for marginalized populations?
So there's a lot of ways to do it. So a lot of the larger health plans are partnering with newer networks and vendor partners to make sure that their networks are culturally inclusive. And you can do that, whether it's through your health plan. We have chosen intentionally to direct contract with a lot of these vendors. So whether it's culturally competent from from an ethnic perspective, whether it is a vendor that specializes in transgender or, other types of sexuality health. We felt it was very important to make a statement to our employees that this is such a high value for us. We're going to show you we intentionally contracted with somebody to tell you that this is important to us and we want to do it. A lot of our employees don't trust their health plan. I don't know if you trust your insurance company, not as a vendor partner, but as a user. So when sometimes if they embed some of these services in there, it's the same, but it's a perception issue. There's also really great companies out there right now like Violet that are looking at your employee population and then layer on top of it network physicians that are around them by the individual level so that you can look at by your very specific population to see if you actually offer a culturally competent network based on your very specific employee makeup. And so we've done that a few times nationally in the US so that we could definitively make the statement, based on our employees, everyone has access to a provider that looks like them, feels like them, talks like them, can understand them, because at the end of the day, we might talk about, it gets better outcomes, but really it's the right thing to do, right? There are many of us here where it's really easy for us to find somebody that looks like us when we want to seek healthcare, but it's our jobs as leaders of these organizations to make sure that that is available to every single person that walks through our physical or virtual doors. And that's why it's so important to engage with companies like this so that we know that every one of our employees has that opportunity.
And if I might just briefly add, this is something that's sort of very near and dear to my heart, because the real challenge in the substance misuse world, and I would even just say overall behavioral health, is that it affects everybody. However, those who are able to access care tend, those who are unable to access care tend to be the more marginalized group. So using substance misuse as a classic example, right? You might have priority access, for instance, to rehab, but who can actually go to rehab if you're a single carer at home, if you have other duties, to your family, if you have, there are so many considerations that mean that the vast majority of people can't just check out for 4 weeks or 6 weeks and participate in that type of program. So certainly the solution that we've seen being incredibly effective is virtual care. Virtual care can be a great way to democratize access for marginalized groups of people to high quality healthcare that has outcomes as good as in person.
Yeah. So just wanted to add a bit on that. So for us, considering the spread of countries that we operate in, for us, a lot of this comes down to how do we make it very personal for people, given different cultural nuances? So, we have people speaking different languages, for example. So we try to look for services wherein we partner very closely with our local HR teams, because sitting here in the US centrally trying to figure out these things, it's like, in my understanding of these things are very different. So being able to tie up with local, say Spanish-speaking therapists in Latin America, or like in Ukraine, for example, all our therapists there speak like different languages, and definitely Ukraine, of course. Most of our training programs that our SoftServe University churns out are available in different languages, so people just feel comfortable learning something, when it's given to them in their native language. So that sort of intentional focus to make it as local and personalized as possible, I think that helps a lot in being able to really meet people where they are. That's been the way we look at it.
Great. So often we focus on mental health after the fact, but what can employers do to promote good care in a preventive way without pathologizing everyday life? You guys all want to take a crack at that one? I think this is our last question. So,
I definitely think that promoting well-being is definitely important, as far as making sure that employees have the resources, making sure that their families are having, making sure they know about the benefits. So if they have a mental health issue, that they know where to go to get care. Or if it's medication management, that they know where to go to get care. So I think that's really crucial, and working with either your ERGs, or we actually added well-being champions to make sure that, again, sometimes employees don't feel comfortable coming to HR or benefits, but they will speak to someone who maybe is a coworker or a colleague that works with them, but they happen to be a well-being champion who knows about the benefits. So making sure that your well-being champions can promote your great benefits, and so employees have access to them.
I think at Parsley, it's really about, as I've shared earlier, looking at mind and body as not separate. We are not psychiatrists, psychologists, or therapists at Parsley Health. We are a dedicated care team program with mostly internal medicine, family medicine trained doctors, health coaches, and nurses. And everyone in on our staff goes through an in-house fellowship in root cause medicine. And if you're not familiar with root cause medicine, it's about asking the why. Why are you tired all the time? Why are you depressed? And so about 20% of our patients come to us with behavioral health issues, chronic fatigue, depression, anxiety, and the like, as their number one chief complaint. And then for all of the rest, a behavioral health issue is the most common second chief complaint. So we're looking at this all the time. And then what we do is we look at this patient holistically and say, okay, why are they depressed? Why are they anxious? I cannot tell you how many people, especially women, have been put on an antidepressant when they had a thyroid condition that no one bothered to test for. If you have hypothyroidism, as 1 in 8 women will be diagnosed with in her lifetime in the US, you will be gaining weight, exhausted, depressed, and so forth, and a number of other symptoms. And these things aren't looked at holistically. And so I think, making sure that our medical system as a whole is thinking root cause, as we are at Parsley, understanding that mind and body are not separate, doing the right tests, looking at the body as ecosystem, and understanding what the interplay is between mental health and physical health can go a long way, not just to destigmatizing mental health, which I think is starting to happen, which is really awesome, but to actually figuring out what is the best treatment for this person. We diagnose these conditions, we treat them, we offer first-line medication therapy, so antidepressants. We refer out to CBT and therapy and other types of services that we don't provide. And then again, for a subset of our patients, a really meaningful one, we're able to help them get off of medications or actually resolve their mental health or behavioral health condition because the root cause wasn't in their heads, it was in their bodies.
It goes back to how I started. Actions speak louder than words, and ultimately what we find to be effective is really 2 things. It's first making sure as an employer you have the right sort of combination of vendors, depending on your population, that can really serve their needs. And typically what we see most regularly is that sort of mental health and substance misuse are 2 sides of the behavioral health coin. And if you have a specialized solution across each area, you can really ensure that people are able to find care when they need it, but also just not making, ensuring that these aren't just benefits that sit in the portal that aren't promoted, because people often feel, a real struggle in putting their hand up. So benefit fairs, mailers, emails, those types of promotions, making use of Mental Health Awareness Month, those types of things are absolute gold, and we see that really help from utilization and outcomes perspective.
Yes, I would say that, it's all about communicate, right? It's the more dialogues you have, the more discourse you have within the organization about these things. It's important for people to feel that what they feel is not abnormal. I mean, there are many who are in the same boat. So having leaders walk the talk, having people come and share their experiences, so the more, like human resources or other groups can orchestrate that kind of discourse within the organization, I think that is like the biggest thing that we could do to sort of, at least in the workplace, to make people, feel that there are ways in which they can, take care of themselves.
And I'll wrap this up with, I actually think it starts with each one of us. We have to take good care of ourselves, and then we have to talk about it. So you have to tell your team, I need to take a walk here to clear my head for a moment. You need to, when you tell your coworkers, hey, I just talked to my therapist and we talked about this and this is on my mind. I'm having brain fog and I can't concentrate. Are you experiencing that? You have to open up. You have to feel and realize what your priorities are. It starts with you, and then you bring it to your organization and you bring it to your coworkers. And then and only then will it become a priority. If it doesn't start there, it's never going to happen.
Great. Well, thanks so much. I really appreciate all your insights. Give it up for our panel.